Good evening, everybody, and welcome to the Faculty of Sport and Exercise Medicine webinar for the new exercise medicine diplomates, and also for people who are thinking perhaps of becoming one. I'm Natasha Jones. I'm the president of the Faculty of Sport and Exercise Medicine, and I'm joined today by Andrew Cuff, who is our lead for the faculty diplomates across all three areas. We're going to start tonight by a little bit of an introduction from me, both to the faculty, what we do, and then to physical activity agenda particularly, and what we do in that agenda, what I think the national picture is currently looking like, and what we're currently doing for that national picture, and therefore how you can get involved and hopefully impact on the agenda in the way that you want to. So as I said, I'm Natasha Jones. I'm president of the faculty, and I'm also director of Moving Medicine, which is our sort of flagship initiative for physical activity that we've been developing since 2018 now. Could I have the next slide, please, James? So our vision as a faculty is to improve the health of the nation through physical activity. So this is a very obvious agenda for us to be involved in. We're also involved in two other key agenda, musculoskeletal medicine and sports medicine. But as I said, our vision is very much about physical activity, and then musculoskeletal medicine and sports medicine just support that. My mission as president has been to try and develop a strong, unified voice for the sport, exercise and musculoskeletal medicine communities, and importantly, to move our faculty from what was primarily a doctor-orientated faculty to a multi-specialty, multidisciplinary faculty, soon to become a college of sport, exercise and musculoskeletal medicine, as we merge with our partner association, the British Association of Sport and Exercise Medicine, in the coming months. Next slide, thank you. So what do we actually do as a faculty? Well, first of all, we are the sort of professional voice for our areas of expertise, and we advocate for that professional voice in government, through Health Education England, and through multiple other professional organisations. And we'll tell you more about that later in terms of our partnerships on the physical activity agenda. We are committed to driving up standards through sport, exercise and musculoskeletal medicine. And we do that through standard setting, through examination, the diploma examination being one of those exams, but obviously there are others, and through appraisal and revalidation, particularly of doctors. We also run professional accreditation with the GMC for doctors. We are involved in education, although BASM primarily have that role, but our role in education has been much more on the physical activity agenda than anything else, particularly since Moving Medicine came about in 2018. And also we do a lot of professional support for our members and fellows, through leadership development, through mentoring opportunities, through running complaints processes, through supporting a professional code, and through other things like fellowships. Next slide, please. As I said earlier, we are working with the British Association of Sport and Exercise Medicine following a membership vote of both of our organisations to become a merged, joint, new college of sport, exercise and musculoskeletal medicine. Importantly, this is going to be a multidisciplinary, multi-specialty college, and that's why we're so excited about our new diplomat members in all three areas. You'll see on the slide there are three main pillars of what we do, which I've talked about already: exercise medicine, MSK medicine and team care, and all members can be involved in those pillars. So as an exercise medicine diplomat, you can sit within the exercise medicine committee and you can lead various agenda with us through that committee. So the membership structure will be a very much a sort of vertical structure involving all fellows, members and diplomates, and importantly with an input from associate members and others like exercise professionals and trainees. We do recognise professional qualifications in our membership structure, and that's the difference between an association and a college or a faculty, in that our membership is governed by qualification. Next slide, please. So I'll just now come on to moving medicine and talk a little bit more about the physical activity agenda that that we support through our Moving Medicine initiative. This was initially started, as I said, in 2018 on the back of an initiative between what was Public Health England and Sport England. And this was an initiative designed to improve education around physical activity for healthcare as part of a programme called the Moving Health Professionals Programme. That's since moved on quite substantially, and I'll talk about that later. But we originally got involved to develop resources for healthcare professionals to essentially improve their understanding of physical activity. Next slide, please. Our initial brief when we first talked with Sport England and Public Health England about this was to create essentially a UK-based textbook of physical activity medicine. This had already been done globally in various iterations, one notably in Sweden, but also in Canada and through the Exercises Medicine Initiative in the States. We decided to do something a little bit different rather than reinvent the wheel. And we decided to really major on the value of changing behaviour when we're talking about physical activity interventions, because the evidence base told us that although most healthcare professionals are fully aware that exercise is a good thing, a lot of healthcare professionals didn't feel they had the tools and skills to deliver physical activity intervention through their jobs. Next slide, please. So through a behavioural change model, which became Moving Medicine, we are working hard across medicine, nursing, physiotherapy, and other areas to upskill professionals in those conversational techniques as applied to physical activity. And I'll give you some examples of that now. So if we just go to the next slide. The Moving Medicine platform, I'm sure many of you will already be aware of, started off on the left there with consultation guides, and that was our initial answer to Public Health England in 2018 when they asked us for a textbook. We started off with 9 different conditions, which have now expanded to 21 different conditions. And essentially, we developed consultation guides to give clinicians a consultation framework with which they can discuss physical activity with patients in a way which is likely to have meaningful behavioural change impact. We've also developed children and young people resources with the through a partnership with Scotland. Alongside that, back in 2019, we started the Active Hospital project as a pilot in Oxford. That has now been rolled out to 4 other sites nationally and is supported through the Moving Medicine website by a toolkit, which essentially talks about system change for physical activity rather than individual consultation change. So the toolkit, if you look through it, has a number of different case studies for different disease areas in health. That is an iterative toolkit which we welcome further development of, and people are invited at any point to submit their models and case studies for publication so that we can share them and discuss them. Alongside the Active Hospital project is an Active Hospital community of practice, which has been very well received, and there's been a lot of activity through it to discuss various case studies and pathways as people try and implement physical activity through their own particular area. Next slide, please. Active Conversations is our course. In fact, we have now 2 courses to teach particularly motivational interviewing skills. We have a foundations course and a longer course. And this is run with the Academy of Health Coaching, who've been doing this for many years. We're just introducing a 3rd course, which is really centered around conversations around risk, because we know that patients particularly, but also some doctors and other healthcare professionals, do perceive risk in physical activity intervention as a really big problem for them. So following lots of work we've done on that in the last 2 or 3 years, we have now developed a training module to support that particular problem. Next slide, please. So when we first started this intervention or this agenda, it felt a little bit like this, that we were swimming upstream with a big bear, which was NHS England, staring down at us. And it felt pretty scary and improbable that we were going to really make an impact in such a big beast that is the NHS. I have to say, I feel much more optimistic now in 2024 about progress. I think we as a multidisciplinary organisation have really started to impact on people's thinking about how to deliver physical activity in healthcare, and to an extent action. We have had a lot of funding through Sport England, which is DCMS funded, and we have some impact through NHS England, although that needs to be capitalised on more, particularly as we enter the next few years. Next slide, please. So the challenges which directly affect healthcare around physical activity, and I'd really appreciate a further discussion about this from any of you who might want to discuss any of these a bit later as we get to the discussion phase of this webinar. But I'll just sort of go through what I see the main challenges are at the moment, following lots and lots of discussions at a national level. In health, I think we have lacked a multidisciplinary organisational leadership of this agenda. I think there have been a lot of people who've done a lot of work and a lot of fantastic work, but the leadership of that agenda, I think, has been lacking. So the impact of the small pockets of work that have, or relatively small pockets of work that have happened, has not been as big as it should be. We think at the faculty we are starting to have an impact on organisational leadership, and we're keen to share the work of others through that. The multidisciplinary component of that leadership is really important to us, and the multi-specialty components of that leadership, because I think when we're talking about system-wide change, which is what is going to be required in the NHS, there needs to be a multi-specialty, multidisciplinary voice. And that brings me to the second point about how to utilise existing healthcare resource to have the maximum impact. We all know that there isn't much additional resource in the NHS, despite the fact that all political parties for the next election have talked about prevention as being key. There doesn't seem to be an awful lot of tangible funds to follow that. So we need to think about how we use existing healthcare resource, how we use our fantastic NHS workforce to the maximum that we can without overburdening them. We need to make physical activity more accessible for people with long-term conditions, particularly addressing the health inequalities. We know that poor health outcomes are adversely affected by low physical activity, and we know that the people with the lowest socioeconomic backgrounds have the lowest physical activity levels generally. So physical inactivity does drive health disparity. We need to think really carefully as we start to communicate directly with patients rather than through healthcare about how we make sure that we close that gap rather than widen it. A part of that, and that brings me to my last point, is about changing the culture, the national culture of fear around physical activity, which has really been a societal norm for so many years. The idea that if you suggest to somebody they might want to get more active, that you're going to be responsible if they have a heart attack. The idea that a lot of patients have that physical activity is going to make their symptoms worse, it's going to make them fall, it's going to make them more breathless, more tired, make their pain worse, wear their joints out. We've all heard it all so many times before. So addressing that risk, both through healthcare and directly with patients, is really key. And this is an important agenda to Sport England at the moment, and I'll come on to that in a second. So if we go on to the next slide. So this is a sort of an excerpt of the Moving Medicine strategy, and I just put it up here to really demonstrate and illustrate that we do not work in isolation at the faculty. We work with multiple partners, and I've listed some of the partners we are currently working with on this agenda, including Sport England, who are a very important partner to us, but also OHID, the Academy of Medical Royal Colleges, Nuffield Health, who have been a big supporter of ours, and the Academy of Health Coaching, who partner with us on our courses, and a lot of other work that we do. We're starting conversations with Google about patient-facing resources, with Intelligent Health, who are a very important primary care organisation, with Sheffield Hallam University, and several other big academic partners. And we have international partnerships with Australasia, with the US, and with others, smaller partnerships. Next slide, please. So what are we actually doing at the moment? What are the projects that we're currently working on that we'd really love people to get involved with and help us with? Our Moving Medicine website is currently undergoing an upgrade, and that will improve its functionality, particularly addressing multimorbidity rather than single disease areas. Through that website, we'll also be hosting a community of practice, which will be divided into forums, some of which will be disease specific, but some of which may be local forums for people who want to have local conversations about what else is going on in their area. We're involved in the Physical Activity Clinical Champions Programme in partnership with Sheffield Hallam University and Intelligent Health. This is a big hallmark of the original Moving Health Professionals programme, and it is a large programme designed to train healthcare professionals in how to talk to patients about physical activity, and also how to train others to do that job. We have just finished developing a whole new suite of resources, training resources for healthcare, including slides, podcasts, and webinars. That will all be published on the Moving Medicine website and will be freely downloadable. That is up for more development as the years go on. So if you look at those slides and you see areas that you don't think have been represented well enough, we would welcome you coming to talk to us about that and helping us develop more. I'm just going to talk a little bit more about addressing risk. This is a big part of the Sport England strategy at the moment, because they see the perception of risk and some of the policy around risk as being a big barrier to people living with long-term health conditions. They have recently commissioned several pieces of work from us and from others to decide how best to change the landscape around risk, how to get to change pre-participation screening, for example, so that people with long-term conditions aren't immediately excluded from organised physical activity and sport. That's a really exciting agenda, and I think if we could be successful in what Sport England want us to be successful in, it will dramatically change the landscape in health. We are working with Nuffield Health on patient-facing resources. So the Moving Medicine website at the moment is primarily a healthcare-facing resource, although it is freely accessible. We will over the next 2 years be developing a patient-facing version of Moving Medicine, which I think is really exciting. We are also working with other partners, looking at how we can make that interactive, perhaps bringing in some generative AI technology in order to really make it feel like a personalised health coaching approach. Again, this is an enormous project, which I think could have real impact if we get the right people involved. And again, really excited from any interest that you guys might have in that to come forward and talk to us about it. We're developing our courses, as I said earlier, with our new management of risk course. And there will be further courses and training opportunities through the Physical Activity Clinical Champions programme. And then really excitingly, as you know, we've had our first sitting of our diploma examination, and we will be continuing to run that. And we're so pleased with the interest in that already. And next question, please. So how can you get involved? People who have passed the original diploma exam and want to get involved. Well, we're just about to form an exercise medicine committee, so we will be inviting nominations and election from the diplomates for representation on that committee. We would like a really strong diplomat representation to make sure that committee is multidisciplinary and multi-specialty. We'd love you to get involved in any of the developments that we're currently working on. So if you'd like to contact us, and we'll put you in touch with the right people. If you have new ideas and innovation that we haven't thought of, we'd love to be able to support you to develop that further through any of our initiatives or any new initiatives that you might come up with. And we are always looking for mentors on our courses. So people who've done our courses and who would then like to be mentors on our course, we welcome new mentors. Next slide. So with that preamble, I welcome you to this webinar. I really hope that I've stimulated some thought, and we'd love to have a discussion with you after Andrew has spoken about any of the things that I've discussed or anything that springs to mind. Andrew.
Brilliant. Thanks, Natasha. Thank you for those who've already put questions into the chat. Please do keep them coming. And as we get towards the end of the webinar, we'll be picking up more of a Q&A, or pick the questions out the chat, but please do keep those coming through. I probably just wanted to start off with the MDT theme, probably to begin with, before kind of getting into the kind of substantive aspects of my session, which is really to call out, well, this is a faculty that not only talks about being an MDT and embracing an MDT, but demonstrating it through action. And I think that's a real kind of benefit to diplomate members at the moment, and to kind of, I wouldn't be presenting on this webinar today if it was talk and not action. So as a physiotherapist by background, I've only ever felt welcomed in the faculty, and an organisation that is really championing the benefits and the advantages that come with the diversity of thought around such an important physical activity and MSK agenda. So I think it's a really exciting time to be involved with the faculty for all of the reasons that Natasha's just outlined. If I go on to the next slide, please, James. Excellent. Right. So this is largely what I'll try and talk about in the next kind of 15 minutes or so, then hopefully give enough time for, well, probably less than that, 5-10 minutes or so. And then we'll go into kind of real meat of the discussion. Looking at the sign-up list, over the last couple of weeks, what was really encouraging to see, there was lots of people from different professional backgrounds. Like I said, we've got close to 40 people on the webinar this evening. So I just wonder if you could pop into the chat your professional backgrounds, whether you're a GP, a nurse, a trainee, a physiotherapist, so on and so forth. So we can get a bit of a flavour of who's on the webinar tonight. That would be great. Please do so. One of the key things when we get into the discussion, and probably just to give you a bit of a heads up, is we do want to hear from you tonight. There's a healthy amount of Natasha and I speaking. When we get to the exercise medicine bit in Substantia, we really want to kind of hear your thoughts, your opinions, your views, and particularly what we can do more of. So thank you. Please do keep those background professions coming in alongside the questions. So next slide, please, James. Cool. So you're all invited onto this webinar tonight because you'd registered an interest in the diploma in exercise medicine. And as Natasha alluded to, we have 3 diplomas within the faculty. The diploma in MSK medicine, which we've now gone through 4 different sittings, and the diploma in team care, which is coming online very, very soon. Now, one of the key things that Natasha alluded to there is how not only have we got the diplomas to start or to offer membership into the faculty has just gone through a reorganisation or restructure to really ensure these 3 pillars flow all the way through everything we do as a faculty. It's the aspect of how both our actions and our words align to both the vision and the structure of the organisation. Everything's starting to piece together towards that college of FSEM and MSK moving forward. And I think the key thing here, and I'm struggling not to use the pun of things will only get better for those of you who are UK based and have seen recently, but that structure can only mean we kind of further harness the benefits of diversity. And I really want to call that out from a diplomate perspective. So at the moment, we have an MSK diplomate committee, which I chair and then represented within the council. Moving forward, we will have an MSK committee, we'll have a team care committee and an exercise medicine committee made up of fellows, members and diplomates. So a real opportunity for everybody to get involved, but also to lean into the expertise across the faculty, across different sectors, whether it be NHS, be private practice, whether it be sport, whether it be the military, but also different professional backgrounds as well. And I think for me, that's the real underpinning about why it's special and what the opportunity there is to be as part of a member of the faculty moving forward. So these are our 3 diplomas. Now, you may, and I think I looked through the sign-up, the majority of people that signed up have already done the MSK medicine. A few went on to exercise medicine. And I can already see there's a question in the chat regarding, well, what if you do all 3? What opportunities exist? And to keep the suspense going further, we'll answer that question towards the end of the webinar. Next slide, please, James. Now, because I'm an awful public speaker, I thought I'd take the opportunity to use some edited content to demonstrate the benefits of working in the faculty. So, James, can we try and play the video if that's okay? And fingers crossed it works.
To join the faculty as a diploma member, a really multidisciplinary group. So we have AHPs, we have GPs with extended role, we have aspirational GPs with extended role, as well as orthopaedic surgeons within the diplomate committee and within the diplomate membership. What we're trying to do as a committee is make it really attractive to be a member of the faculty. So I've talked about the podcast, I've talked about accreditation and ongoing CPD. The real benefits to me, I think, are leaning into some of that multidisciplinary expertise. So not just within the diplomate membership, but we start thinking about team care, exercise care, the members and the fellows. And a real opportunity to get involved with where musculoskeletal is going, particularly as a profession, but also as a kind of specialism around physical activity, whether that be in sport, whether that be in the military, whether that be in the NHS. So a really exciting time to join, purely because there's lots going on. There's lots of ideas that we want to take forward and make it a really attractive place to come, grow, thrive, network, and help people to continue to professionally develop and get the most out of their rewarding career within MSK.
That's great. Thanks, James. If we go on to the next slide, please.
Really
I think one of the key things to kind of get across, and as mentioned, the reason why we extended the invite this evening was some of you on the call will have done the exercise medicine exam. Some of you hadn't, but expressed an interest. Some of you have become diplomate members already. some of you haven't, some of you might be thinking about it. And what we really want to hear from you in the discussion is some of the rationale or thoughts or underpinnings that kind of underpin some of those decisions. Now, becoming a diplomate member does come with some kind of specific benefits, as well as being involved with a faculty that's influencing a political level, whether that be directly in patient care, whether in commissioning of models and physical activity, as Natasha alluded to, is really the kind of the hot topic, not just through Sport England, but also NHS England, and even at a kind of a governmental level. You may have all seen the kind of MSK physical activity hubs, looking at how we might utilise leisure centres and existing community assets to support people with long-term conditions, which will be a centrepiece of the major condition strategy. So time is now really to be kind of getting involved to support and to influence and shape that future direction. And in that edited video, I talked about how we had some exciting ideas we wanted to take forward. However, those are the only things we thought of now. And part of what we had to do is kind of prioritise what we go after. But equally, we know that there's no monopoly on good ideas. So we really want to kind of continue to grow our membership, welcome new members, so that the new ideas and the good ideas keep coming through. There's more that we can do to offer to people that join, and also to really enhance the benefits of being involved within the faculty. So I've snipped this from the website, and we've kind of alluded to networking being a big factor, and access to monthly news resources and monthly newsletter and resources that come through via email. But also just wanted to showcase some of the things that we've been doing currently as diplomates within the faculty that are starting to bear fruit, but also to give you a bit of an idea of things we've already got in train. So you may be familiar, we have a Faculty of Sports Exercise Medicine podcast, which is now taken over, well, actually no, started in Diploma Committee under Giles Suzanne, recently taken over by Dr. Ralph Mitchell, GP with extended role from Leicester, and Claire Sphera, a physiotherapist based in London. And we've got a real tempo now of monthly content coming out across a variety of topics relevant to MSK, exercise medicine, team care. The most recent one looking at rheumatology and identification of inflammatory conditions, but also the role of physical activity within the management of rheumatological conditions. We have pushed forward with developing a framework for GP with extended role accreditation, and I can see in the chat a number of you on the webinar this evening are GPs, and we're about to launch and go into pilot to think about how we can support people to go through demonstrating their capability as a GP with extended role, initially in MSK and rheumatology, but we've already started thinking about, well, what about that role of a GP with extended role in physical activity? What about that GP with extended role in exercise medicine? What's the art of the possible once we've demonstrated this proof of concept? Now, that will be on the roadmap in time, but these are the kinds of things we're thinking about as a faculty and thinking about as diplomats we want to take through to council in order to try and get some support for. The exam itself, so the ability to pay forward your experience. You'll know that the diplomatic exams were previously administered in the Royal College of Surgeons, Edinburgh. We've now moved that in-house, and that comes with opportunities to be involved with the exam setting, the standards committee, the ability to post-exam be involved with the benchmark setting, so kind of again to play forward and also accept those opportunities. We've currently in the MSK diploma have somewhere between 500 and 600 exam questions. We refresh those year on year to ensure we keep it contemporary, but also ensure that we're maintaining the quality and the benchmark for new members. On the 24 roadmap, we wanted to kind of lean into some of the experience around mentoring and the benefits of mentoring from a multidisciplinary background. So Natasha alluded to our out of the blocks committee for new consultants. One of the things we're thinking about is, well, how can we offer up a similar initiative for people that join the faculty as diploma members? How can we link a diploma member interest in MSK maybe with a member in MSK or a consultant in MSK, so we can really kind of develop some of that cross networking that comes with a multidisciplinary membership. Next slide, please, James. Cool. So hopefully we've been a bit of a scene set of what the faculty is, what it's doing, what's on the agenda and how we're influencing at the moment. But we want to kind of hear from you, and particularly from an exercise medicine perspective, but don't be constrained by that if you want to talk about team care or MSK care. But these are kind of the questions that are in my mind when thinking of kind of planning this evening's webinar. in particular, what were you interested in about the exercise medicine diploma? Now, I'm a MSK physio by background, and when we think about MSK, that's fairly kind of common out there. We've got MSK services, MSK departments. From a physiotherapy curricular point of view, we do an MSK kind of curriculum through our training. Exercise medicine is a little bit different to that, isn't it? We don't typically have exercise medicine services or exercise medicine departments necessarily in that purest sense of how we might utilize that term. So what was it that kind of made you think, oh, that's the diploma for me? What are your future aspirations, whether that be within exercise medicine or broader within the faculty? Why have you joined this webinar tonight? How might you think the faculty can support you moving forward? So I'm going to shut up there and pause, but over to you. If you want to come off mute, if you want to put your hands up, if you want to be your camera on, or want to put something in the chat, please do.
Can I say something? Hello?
I hear you, yes.
Yeah. Can you hear me okay?
Yes.
Perfect. So my name is Dougie. I'm one of the new Diplomate members. I did the exercise medicine exam back in January. Thank you for your presentation. So I was just so what interested me in the diploma? Well, I'm very passionate about exercise medicine, physical activity. And I strongly believe it is the future of healthcare, and that my future aspirations with the role are to work as much within advocating physical activity, not only to staff and students, but also patients as possible. And how might the FSEM support me? I was just wondering if there was any sort of initiatives going around integrating more exercise medicine into the undergraduate curriculums, because well, I personally didn't know anything about exercise medicine when I graduated a few years ago, and I still don't think it's that much in the undergraduate curriculum, and also not a lot of staff in hospital know about the role of physical activity, and even know about moving medicine. So I was just wondering if there was any initiatives from that side.
Thanks, Dougie. That is such a great question, and congratulations on your diploma, and really looking forward to meeting you. In terms of undergraduate curriculum, it's such a great question. There was originally a lot of work done in this area through the Moving Health Professionals programme, and there was a specific dedicated piece of work around undergraduate curriculum. They came up with a couple of challenges. First of all, they absolutely reiterated what you said, is in that physical activity is underrepresented in all undergraduate curriculums, and we're not just talking about medicine; it's underrepresented in nursing as well, and that's particularly in secondary care, where most intervention will actually happen. So really key area. We came, well, it wasn't us who did it actually, it was another organisation, but one of the key problems was actually getting something new into medical school curriculums and nursing school curriculums, because those curricula are so crowded. I'm pleased to say that there is conversation going on at GMC level at the moment about redesigning medical school curricula to an extent, to reflect the challenges of the future, and to make it easier for I hesitate to say new interventions, or novel approaches to be integrated. So I think if that's an area you're particularly interested in, there's lots of work going on. We have several fellows who are really interested in that, published a lot in it. And so if you want to get involved in that, that would be awesome. Your second question regarding how to integrate this into secondary care, again, very, very good question. The Active Hospital Initiative was the sort of first faculty step to do that, and we have a number of case studies across loads of different disease areas, one of which is mental health, and there's huge opportunity to continue to develop that. The Physical Activity Clinical Champions Programme is specifically now looking at a system-wide approach to get physical activity better understood in secondary care. Again, that will be coming over the coming months. So I think in summary, there's a lot going on. We need energy, and we need people like you who are passionate about this agenda to help us take it forward.
Oh, thank you for your answer. No, it sounds very exciting, and I'd certainly want to be involved with sort of those discussions with the GMC, trying to get more exercise medicine and just lifestyle medicine in general into the undergraduate system. It's particularly relevant to me because I'm doing a teaching fellow role next year, so I'll be teaching medical students within the secondary care setting. And I was thinking about how I could integrate more exercise medicine into their teaching, and potentially doing some work around that. So, but yeah, it all sounds quite exciting. Just more on the integrating it into the hospital and making sure staff are aware of, the exercise, the moving medicine resources, etc. Are we doing anything about that? Because to be honest, I don't think I've spoken to anyone who really knows what moving medicine is. And it's such a fantastic resource, yet nobody knows about it. It's not, posted around the hospital or anything like that.
Yeah, it's trying to sort of get through things through organisations like the NHS is really difficult, and you'll find that some areas are much better informed than others. We'll put the link into the chat for the contact you need at Moving Medicine that you can just get involved with, and then we can continue this conversation about how what you'd like to do and how you can keep involved.
That sounds good. Thank you so much.
Yeah.
Natasha, I think something just add on that, the Moving Medicine initiative is such a fantastic resource. I know we talk about it a lot, but I think it's one we just don't talk about enough as members or interested parties. So one of the things we talked about in the last Diplomate committee was how all of us have a role to advocate, to champion, and to share. So we took the action of, well, what can we do within our gift, within our control right now to make more people aware? And we took an agreed action, so to speak, of making sure we shared it within our organisations, or at least 1 or 2 people. And from a physiotherapy point of view, we're often doing primary care education. GPs often come to musculoskeletal services for their kind of protected learning time, for things like how do you examine a back, how do you examine a knee, and fairly typically it's a physical examination in 10 minutes, or differential diagnosis or whatever. And we think about actually what can we do that could support somebody in what would have a greater impact of supporting somebody in a primary care consultation. And the consultation guys on Moving Medicine was what we centered our bits and pieces around. So that concept of all of us are advocates and all of us are champions, particularly when we're interested and believe in this space. I can see, is it Amara? Apologies for pronunciation, who have their hand up.
Hi, Amara, almost. No problem. No, thanks for a fantastic presentation. And I'm a GP, and I'm an old hat actually, and I'm a clinical director of a primary care network. So I lead a group of 9 practices in quite a deprived part of London, and we run a physical activity program to help reduce health inequalities. And it's funded by our Integrated Care Board. It's a small bit of non-recurrent funding which we've received for the last 2 years, and it's been brilliant, and we've demonstrated really good health outcomes. And what we do is we use a model whereby we have our GP practices refer in patients who may never have exercised, or never been to a gym. We've got a homeless practice, we've got people who don't speak English, we've got people from different cultural backgrounds, but regardless of all of that, with very small investment, we've actually demonstrated some really good outcomes, both in physical and mental well-being of patients going through the program. So things like waist circumference, blood pressures, diabetic measures, mental health markers, patient-reported self-help measures are all improving. And one of our key things is we've reported back to the ICB, but finding recurrent funding for things like this is the challenge, and making these things sustainable, and also sharing our learning. So that was one of the reasons I did the diploma, and I did the diploma earlier on this year. So my question really is, Is there any way that we can influence and take some of our learning and our evaluations to people like NHSC, Sports England, and find new resource or find ways of sustaining things like this or rolling them out more widely?
Thanks, Mara, and well done. First on doing the diploma, but secondly on what sounds like a really impactful intervention, and I'm sure a huge amount of work that you must have put in to get this going. And so, having done the similar thing locally myself, I know how hard it is. So well done. I think the short answer is we'd love to talk to you. We'd love to hear more about your intervention. We'd love to see your evaluation. We'd love to talk about how we can share your learning and integrate your learning into our approaches to various organisations who do fund things at a national level. So again, if you wouldn't mind emailing the address in the chat, we'll set up a meeting and then we can have a proper chat about it all.
Fantastic, thank you.
I think, Amara, one of the things that I'm involved with currently, looking at the physical activity hubs that were announced from the spring budget last year, and very mindful that we're about to go into a period of PERDA and whether that kind of moves forward at the same pace as it was. But that was largely looking at going out to tender for essentially almost like a phase one pilot of how this could look. So supporting existing models to scale, but also supporting existing models to inform what ICBs might be thinking. So there's some money in that space, which again equally would be useful to kind of put some thought to. But it's always a challenge, isn't it? And I think you hit the nail on the head in terms of the non-recurring funding aspect of things, where you kind of get towards the end of the financial year, some money's not spent, and you kind of, oh, here you go, do what you can do for that over a 6-8 week period, and hopefully it sustains like you've experienced, but nothing you could ever kind of plan forward long term. So yeah, definitely one of the challenges, but it sounds like some great work. I'm really interested to see your outcomes. Yeah,
and there are opportunities, Amara, through various things, so it would be good to talk to you about that.
Michael.
Hi, so I just want to say thank you for the talk. I really do appreciate it. My name is Michael. I am currently in F1, studying practicing in Peterborough at the moment. So very, very new to professional life. It's actually part of the reason why I wanted to do the exercise medicine diploma was because I guess I'd recently discovered I was really interested in sports and exercise medicine. It kind of encompasses all the things I really enjoy about medicine, and it was like the first thing I could do basically to kind of further my interest and develop further in it. So I actually do eventually want to become a sports and exercise medicine consultant, hopefully at some point. And I think my question would be, in terms of kind of supporting maybe people who are very, very new with their interests, or maybe don't have as much professional experience as well, because it seems like a lot of people in this call are very experienced in their fields. It would be interesting to know how, I guess, FSEM kind of supports people in my position, I guess, who are very, very new and exploring their interests, but still want to kind of get involved as much as possible. I, for one, for example, am really interested in like medical education, and I thought by becoming a diplomat member, as I have become, that I would have loads of resources that would have been available to me to learn from. And I know that maybe that's not necessarily the case right now, but that would be something that I'd be really interested in trying to work towards developing with the faculty, as an example.
Thanks, Michael. Do you want to start with that one, Andrew?
Yeah, absolutely. And I think that's, Michael, you kind of touched upon the mentoring in particular we're trying to get in train at the moment. That concept of joining as a diplomat, one eye becoming a member, a loose eye becoming a consultant, how we link you up with people that have gone through that journey that can share that experience, but also others that might be going through that journey so you can share that experience also. One of the other things we've got on our agenda is particularly to think about the merger with BASM. Obviously, BASM with a real strong educational history is something around kind of MDT kind of case series approach, a bit like a grand round that you would have in a hospital, whereby we want to bring forward kind of both typical cases as well as non-typical cases, and think about how different members of the MDT may approach such a presentation. So, for example, we might have somebody with osteoarthritis or tendinopathy or persistent pain. We start thinking about how we might be picking up, whether that be rheumatological conditions or where we might manage it from a primary care perspective, from a secondary care perspective, from a GP with extended role point of view, from a physiotherapy point of view, from a fellow's point of view. So we can start to lean into some of that richness of diversity. And to include that as a perk only for members. So we'll do a webinar like today, whereby you might have 3 or 4 different people from different background discussing the same case for the first half of the session, and the second half of the session, a bit like we're doing now, a bit of a Q&A format where people can chip in with their experience or ask questions, so on and so forth. So that's something that's kind of tangibly being worked up at the moment on the educational aspect of things. But mentorship, opportunities such as the case series, opportunity to get involved with the committees, and producing some of that educational content, but also experiencing some of that educational content is really the direction we're going for. And the merger with BASM, I think, will only take us further into that direction. Natasha, anything from you to add?
Yeah, I mean, I think we really welcome people early in their careers, and it's so great to hear that we've managed to attract an FY1, which is absolutely brilliant. And the earlier in your career you start, the more you'll get achieved by the end of your career. So let's harness this enthusiasm that I'm sure I can hear you have now. And as Andrew said, the educational offering through Moving Medicine and through the Physical Activity Clinical Champions resources and through the Active Hospital resources are pretty huge. It takes an awful long time to get through them all. But the development of more resources and courses and things is an open book. So if there's anything you see that you don't think is well enough represented through the things that we already have, then we'd love to hear from you. So yeah, keep engaged. And I'm so pleased that you are interested in our specialty generally, but particularly that you've chosen exercise medicine as your starting point.
Thank you very much. Yeah, I'm excited.
Good.
Have I missed any hands?
I can see there's one question. In fact, I think there's a couple of comments in the chat about mental health. This is such an interesting area. Moving Medicine resources do have some resources around mental health, depression, particularly anxiety, and some children and young people resources as well. On the Active Hospital Toolkit, there are some resources around mental health pathways. There's lots of conversation going on at the moment at a sort of national level regarding substance misuse and the role of physical activity in people who are rehabbing from substance misuse. And there's substantial funding as well behind that initiative. So I think that will probably be the next thing that we do on mental health. We're also having conversations, or I've recently been having conversations with forensic mental health inpatient organisations to understand how best to try and implement physical activity in those environments as well. So there's been a bit done. There's a lot to do. Please get involved if that's something you would like to take forward further.
Can I ask a question, Natasha? Maybe Paula, if you might be, if you're comfortable coming off mute, then please do. But if not, or you're not unable to, then please do put it in the chat. One of the things that I was reflecting on is I think the faculty, and Natasha's alluded to this, are really kind of the thought leaders and the lead driving physical activity and the gender at a national level through multiple fora. And Paul, I'm mindful that you're a physiotherapist at background like myself, and we often think of the physiotherapy hat on, the exercise and exercise prescription is one of the things that we're really strong at. Is there not just for Paula, but kind of beyond, when you're looking for somewhere to go regarding support to push a physical activity agenda, or to land the physical activity agenda, or to develop pathways such as you alluded to, Paul, in terms of mental health, you've naturally come to the faculty through a variety of different routes. But I suppose along the same lines of moving medicine isn't really well known outside the faculty and the conversation that we're having internally, on Dougie's point, does the faculty have a reputation regarding our drive in this physical activity? It may be as much as we think we do in terms of some of the work that we're doing. So, for example, the Chartered Society of Physio, I don't think are as active in this space as they could be. And that's where I look towards the faculty as the thought leader. But I just wonder, is that a sense others on the call are getting, or not? And if not, is there more we could be doing to ensure that people are aware of what the work we are involved with, the work we are influencing in this space? Maybe you're typing, Paula. So I think Luke Tao had his hand up a second ago. I'll come to Luke.
Andrew, I am here.
Oh, hi.
Yeah, sorry, I am here. I actually work in for a large mental health trust. So, really, I'm looking more at SMI rather than the more common mental health conditions. I'm aware of moving medicine, have been for years, and it's something that I've alerted all my colleagues to, because essentially it's a brilliant resource to use with people. I've also done the active conversations course, and I found like both are immensely useful resources. But I guess my issue is how do we get physical activity and exercise higher up the agenda for people with SMI, because their lives are shortened by between 10 and 20 years, and mainly because of conditions that could be preventable. Lots of cardiovascular stuff, lots of metabolic conditions, and a lot of the things that kill people we could prevent if we only had kind of the right way of doing it. And I sometimes feel like I'm fighting a bit of an uphill battle as a lowly little physio lead for BSW ICB. And yeah, I mean, I don't know. I mean, I'd love to have a more in-depth conversation with you guys, because I think there's such a huge amount of a difference we can make. I mean, this particular population are definitely, when you look at the core 20 plus 5, they're definitely up there. People find it difficult to access normal resources, like, for example, if someone comes up as pre-diabetic, how many of our patient population will be able to endure the length and breadth of the new NHS diabetes prevention program? It's never ending, really. And I'm kind of looking for some ways to try and get some help, really, to drive it up the agenda.
Well, it's so interesting to hear what you say, and so many of you, so much of your sort of emotion about it, I absolutely recognise, because I feel like that quite a lot in what I do, and what we have done through Moving Medicine. Thank you for your support of that. I'd love to have a proper conversation with you about it. We do have a sort of mental health team who really have done all the sort of literature reviews and so on, and really driven that, and we have also a really good inpatient mental health pathway on the Active Hospital Toolkit. So the team involved in that, we keep involved. So yeah, let's chat and work out, one, how we can support you, but two, how we can bring you in to try and drive this agenda harder through mental health.
Okay, that sounds marvellous. Thank you, Natasha, and thank you as well, Andrew. I've got to go on to my next webinar now, so but thank you so much. Thank you so much. It's been really interesting, and I will catch up with you again in the not too distant.
Great, thanks, Paula.
Thank you.
So good commitment to webinars on a Thursday night, Wednesday night, that isn't it? I wonder if we segue to the Q&A slide. I think we've touched upon some of the questions already kind of organically, and
we've got Luke as well, Andrew. Luke appeared and then disappeared, so I think Luke has a question. Are you there?
Well, I didn't want to interrupt if we're running out of time. It's all good. I'm Luke. I'm a GP in Newcastle, in England. I did join the talk late. Apologies, but it's good to hear. Trying to squeeze webinars in with family dinners and all these sort of things is always a challenge. But fascinating to hear from what's going on. I have signed up as a Diplomate member. Really good to hear what's going on in London with the ICB, with Dr. Hughes and her team, Amara, and her team down in London. Really good to see Paula's interest in driving that forward with the mental health hat. It's something that I believe is strongly underused, and it does form a plank during my consults all the time. Have had a success story even following from completing Diploma, where one of the patients said, feedback to somebody else, best consultation I've ever had with this guy. With all the motivational interviewing and things, that, I didn't expect it to have that sort of impact, but we can make an impact on even granular scales like that as a patient. General comment is, I think, comments from one of my other colleagues when I'm trying to encourage sort of physical activity, trying to encourage things, is that actually it has become almost not a priority with so much guidelines around blood pressure medicines and things, primarily because you can't really measure it as a metric. Or you can, it just depends on how hard you want to drive it. Step counters, are they reliable, that sort of thing. I suppose my question out of it all is, also people are trying to drive this message. Royal College has an active practice charter. You go to any of the cancer charity websites, they do a monthly exercise challenge, April's 100 push-ups a day challenge by Cancer Research UK. There are lots of people trying to drive this space, and all of them have their own message, and all of them have their own sort of separate agenda. And I suppose the key is really whether the faculty can sort of engage with everyone and sort of put it all together, because everyone's got their own separate agenda and what they really want to get out of it. But ultimately, we want to drive the conversation and just get more people moving up from that sort of 55% or so in the adult population.
Thanks, and I'm so pleased to hear your feedback about consultation style and how important it is in terms of how well received patients, well received it can be, and I've personally experienced that many times. But we get lazy, don't we? And we don't do what we know sometimes. I think in terms of sort of, and I talked about this a little bit earlier. I don't know if you hadn't quite got on by then. It was early on about organisational leadership for the physical activity agenda in the NHS particularly, or in healthcare generally. I think that's been lacking, and that's why I think some of the smaller interventions that we've talked about, and Amara is one example, and what Paul is trying to do is another example, why some of these things don't really get national legs, because there hasn't really been that national organisational, multidisciplinary, multi-professional leadership. I think we now have a platform to do that. Nationally, I think we now have a voice nationally through what we've already done, and the point of the exercise medicine diplomates, or the point that I see, it is to really capitalise on what we've done through bringing in these voices and giving them much more national platform. So, I don't pretend that we have the answers to everything by any stretch, but I think it's a step forward.
Right.
Have I missed any more hands, Natasha?
I don't think so. And anybody else who has any further questions, more than happy for you to put them in the chat, and we'll try and answer them afterwards. But I think we've sort of reached time now. We will be sharing the whole webinar for people who've signed up to it. Eric, you've got your hand up. We'll have one last question from you.
Yeah, thank you very much. Just a quick one. So I just want to say thank you so much for this great opportunity of trying to push the physical medicine, exercise medicine agenda to the faculty. I'm personally, I'm a Ghanaian, and I'm particularly very much excited about this opportunity, especially operating within a space where sports and exercise medicine practice hasn't actually gotten to that level of excellence as compared to the UK. I was fortunate to get to know more about this because I am actually also studying in the UK. So I just moved to and fro. As it stands now, I'm not too certain whether I really want to work in the UK or not. But of course, sports medicine or exercise medicine, anywhere, it's exercise medicine everywhere. I mean, to a very considerable extent. And why I got interested in this because I've always been interested in sports and exercise medicine, and for someone who grew up in a setting where it is not well established, I've always been looking for that avenue to enhance capacity, knowledge, and of course also in terms of practice. So I saw this as an opportunity to, open me to that particular world of sports and exercise medicine practice and see how to build up from there. If you ask me, what do I want to get from this? It goes beyond professional career to seeing how best someone who is not directly operating within the UK system can also benefit from such a structure which is primarily integrated within the UK system. And essentially to also find out, I mean, that is connecting me to the third point, how open is the FSEM to helping establish structures and also help, impact in terms of their overall purpose within jurisdictions that are outside the UK. So basically that's my contribution and my question, and also to say thank you once again. I'm grateful.
Welcome, Eric, and it's really exciting to hear that you've chosen to join this webinar tonight. So thank you so much. A short answer to your question is very interested. We have formed international partnerships with people I talked about earlier, but really interested to get involved in other places as well. So we have an ongoing relationship with the Exercise is Medicine Initiative too, who have also got a reasonably good international impact. So yeah, short answer question, really interested to talk. If you have any contacts or if you have any ideas about how you would want that to be implemented, more than happy to talk about that. And I think there's a question here, just a question regarding spinal cord injury and brain injury, a doctor in rehabilitation medicine. Again, welcome. We work really closely with our rehab colleagues at the trust that I work at, and we do a lot of training, mutual training actually, regarding physical activity in these injuries. We did develop a pathway for amputees with our rehabilitation colleagues a few years ago. But we don't yet have a resource for spinal cord injury, and I think it would be something which would be really good to think about. But yeah, welcome. I think it's Peter, and I hope that we can discuss that further.
Natasha, got one question that I said I would answer towards the end, but it's been asked a few times, so I'll take the opportunity to do so before we close, if that's okay. And that's the second question on the slide, which is, if one passes all three diplomas, does that confirm membership status within the faculty? The answer to this is that in our current standing orders, passing all three diplomas does not confirm membership. However, we have a planned EGM this summer to try and pass this as a resolution, because that's our future intent. So if we don't pass for whatever reason this time round, it is indeed the agreed membership structure for the College of FSEM, which we're kind of working hard on behind the scenes and hope to be in place at least this time next year. So that's very much the intent, very much the direction of travel. If someone passes all 3 diplomas, then rather than being a diplomate member, they'll become a member of the faculty.
Thank you, Andrew, for that clarity. So I think with that, it's been a fantastically optimistic webinar for me. It's always so great to hear from people I haven't already met, who are passionate about this area as I am. So thank you so much for joining, and please get in touch, and please join us as diplomate members if you're not already. Please think about putting yourself forward for the Exercise Medicine Committee, and anything else that you think would be useful, we're really happy to talk to you about. So good evening to everybody, and thanks very much for joining us.
Thanks all.